First of all, just a minute, please. See there, today we have to discuss about the writing subtest. In the writing part, there are some rules and regulation of grammar that are important for you, to follow. That are important for you to follow in order to have a good score in writing. So first of all, we have important grammar rules. Let's say how to write down the salutation. Let's say, dear doctor. We can put comma or after a name, and we can write it down without comma as well. Then, if you can see the subject line regarding patient name, his age or date of birth can be written. And the introduction part, you have to see, we need to write it down, certain thing in the introduction part, which include your, let's say, chief complaint, the main issue. You can write it down in the introduction part as well. You can also write it down, like the primary concern in the introduction, let's say. So these are some of the rules that you have to follow. So let's say afterward, the clause of contrast, for example, such as that you can see on the screen. So this is a relative clause rules. Let's say we can write down the introduction in one of the following way. I'm ready to refer Mr. X, who underwent a successful writing replacement for follow-up. Or we can write it down, I'm ready to refer Mr. X, who has been discharged or who will be discharged today after a right total replacement. These are some of the rules. So the thing that you have to learn in the grammar part, let's say, if you can see this clause, like 2-1, this one, and this one. So we have this thing, we can say this is a positive noun. Let's say, what is the positive noun that describes the quality of the noun? So we can use the age, we can use the profession, maybe we can use the, you can say, job title or whatever, or the family status as per the importance. So we can simply write down, I'm writing to refer Mr. X, a 48-year-old man, let's say, who presented with signs and symptoms suggestive of Alzheimer's disease. So the rule of grammar that you have to understand that there is no comma over here. There is comma over here, but no comma over here with relative clause who. When you are completing the sentence, when this is your defining relative clause. And when we have the non-defining clause, such as this is non-defining clause, so we can put comma after man and after disease, right? Anyhow, so these are two basic grammar rules that you have to incorporate in the introduction. First of all, is to add the positive noun to show the impression to the examiner. Number second thing is to use of punctuation of the comma in the introduction with two different style of introduction. So if you are writing in this style, we are not supposed to put comma over here. Okay. If you're writing in this style, we are not supposed to add comma over here. And if you are not writing like in this style, we should use comma in here. Okay. Anyhow. So after that, we have to see this is the tenses in the introduction. In the tenses part, let's say, if we are writing a referral letter, there's a possibility that, and we have flexibility to use different type of sentence structure and tenses variation. For example, let's say if this is your introduction, we can use simple, present, or past, present perfect tense, or maybe perfect continuous tense, etc. in the introduction of referral. Depending upon the importance of the case, you can write it down, the introduction of the referral, right? This is your, let's say, the referral introduction with reference to two tenses, that simple present, or maybe past simple, present perfect, or maybe present perfect continuous can be used in the introduction. Okay, sorry for that. So then we can see that, let's say there are a few examples. We can use the present simple tense or present perfect tense as well. Let's say, who has been unresponsive to the treatment. As per the basic rule of the grammar, if we have something that started in the past and still continue in the present, we can use the present perfect, progressive, or continuous form. Followed by the, we can say, like, we have to see that we presented today with severe chest pain. let's say, and heavy V's. So if we have a presenting symptom, we can write it down the past simple tense, right? We can write it down past simple tense. Then we can see the discharge intro. In the letter of discharge, we can see there, if we can write it down past simple or present perfect tense or maybe future tense with modal verb. So if I am writing this letter of discharge regarding Mr. Smith, who underwent a successful writing replacement, in that case, like we can use the past simple tense in the introduction of discharge. Similarly, we can also write it down present perfect tense in the letter of discharge, who has responded well to the treatment, right? Or who has been responding well to the treatment, depend upon the situation. So a basic, simple rule for the grammar and tenses in the OET writing that will make your writing more easier, more convenient, and you will be able to get a good score in your writing with practicing such tenses and sentences in your OET, because we have some pet rules and regulation to incorporate tenses in the OET writing. Followed by the social and past medical history, if it's relevant, where to write. It's another debate that we had done in our few classes previously, but which tends to be practiced to make it more easy. If we have habits, hobbies, and so on, these things should be written in the present simple tense. Let's say smoker, drinker. And if there is no time frame, if it's not time bounded, let's say if they have not mentioned like since when he has been a smoker or since when he has been a drinker, then we can write it down in the present simple tense. Like he's a smoker, he smokes, he drinks, depend. But however, if we have the time frame given, so we can use the present perfect tense. At time, we can also use the past simple tense in the socio-economic details. For example, the patient had or maybe patient underwent blah blah surgery in 2018. So depending upon the situation, you can use either past simple or past perfect as well. But majorly speaking, we have to use the you can say present simple mostly for narrating any habit of the patient, or like describing any hobbies or habits of the patient. We can use the present simple tense or maybe present perfect continuous tense, depend upon with or without times respectively. Followed by the tenses part. Now, tenses, when we have to explain or expand or to, you can say, transform the case notes in the part of treatment. In case of referral, mostly we prefer or we can write down the complete letter in the past simple tense even. However, when we have to make a comparison, we can use past simple and past perfect. For example, Mr. Andrew visited with the complaints of mild abdominal pain. Now, when he visited you on 1/9/2018, and let's say 10 days back, he had 2 episodes. So we can use the past perfect. He had 2 episodes 10 days back and even a day before. So you can see when he visited, this time frame is different from that time frame. This is near past and this is far past. So we are using the simple form of the tense over here and perfect form of the tense over here. Then we can see here, over a period of 3 weeks, Mr. Alex had visited us 3 times with mild exertional chest pain. So again, basically, if you are writing in the past event, like sometime in the past, we can use our and we can use had as well. All of his investigation, including ECG, were normal, past simple, except exercise tolerance stress, which revealed some ischemic changes. So you can see how we can use we are using variety of tense structure to differentiate the time frame and show our density in the grammar to the OET assessor, right? So afterward, we have to see, we would write it down, these things in here. So now tenses, when we are writing a letter of referral or a discharge. So in case of referral, for today visit, for today visit, we have to write it down mostly either in the past simple, maybe present simple, or we can also write it down in the present perfect, right? So if you can see that we can write it down in the past simple, this is a mistake in the typing mistake, so I will correct it right away. We can write it down in the past simple mostly. Even in the today's visit, we do write it down in the past simple, not or the present perfect tense most of the time, right? Okay. And however, there are some investigation that can be written in the present simple tense as well. Anyhow, so after that, you can see that like plan, mostly we prefer to write it down in referral letter in the passive voice form, right? So moving on toward the discharge plan, discharge letter. Now, discharge plan mostly that has to be executed actually. It should be written in the future form, but we would use modal verbs such as would, could, right, and should or may as well. Let's say this is example. She is vitally stable and is ready to be discharged. So we are using this thing in a present tense. I would appreciate if you could ensure that he can be assisted for her home care. Now here you can see that for the thing that the healthcare professional has to conduct back at home, we have used in the like say modal verb form, or we can see that she will be discharged tomorrow as she has recovered successfully. You can say he discharged his discharge medication or her discharge medication. Sorry, it's a typo mistake again. Her discharge medication includes, no, these have some discharge medication over here. So these are a few examples, like say, that has been done for you, and so that you can better understand the rules and regulation of tenses. So we can see there. Let me summarize things for you that we have discussed the use of different tenses in introduction, right? The use of different tenses in the body of the letter. Then we discuss about how to use in the discharge plan and so on. Accordingly, we have to select the, you can say, tenses as per the importance of the notes. Then we can see that let's understand the present perfect tense, because this is most widely used tense in OET writing. So present perfect tense, we see that we have three options to write it down present perfect tense. Let's say with since, with for and our. So what are the rules of since, for and our? So let's say if we can see there the rules and regulation for since, for and our, we have, let's say, you can see there when we have a period of time without being time mentioned, we can use for that. Like there is no start of time. We don't know like which 3 years, for example. So we don't have the start of time being mentioned. We can use for that. It should be a constant event, let's say. And similarly, then we use the since when we know the start of time or start of that period of time. We can use since for that. Like say he has been waiting since morning. He has been suffering from diabetes since 2009. So according to the situation, you have to you can say decide like when to use since, when to use for, and when to use our. So what is the rule of our? Here we can discuss the rule of our as well. In the rule of our mean, when we have anything that is in repetition, or if there is change in event, we can use our with that. If you can see there, Mr. XYZ condition has deteriorated over the past 4 months. His condition has worsened over the past 2 weeks, and so on. So example of present perfect tense, because this is one of the most widely used tense in your writing. So followed by the past perfect tense. The past perfect tense mostly or widely we use in writing when we have to make a comparison or we have to differentiate two times in past. The first one is far past and second one is near past. So we have to use past perfect in combination with past simple. For the sake of example, if I am going to use a sentence in front of you, let's say she had been on OCP. Yeah, she had been, like attending physio session. However, her range of motion were not improving. So you can see the first part of the sentence was in the past perfect continuous, and the second part of the sentence was in past continuous. We can have another example. Let's say she had attended physio session for 4 months. However, his range of motion did not improve. So accordingly, in combination, we can use the past perfect continuous along with the past continuous, and we can use the past perfect along with the past simple. So there is a combination that you can use when we have to differentiate two events in the past. Let's say these are some example that has been given to you. Let's say we can also use the patient reported that he had noticed blood in her stool yesterday. So it's again the differentiation in the time. So we are using reported as a past simple and had in as a, let's say, past perfect, right? Anyhow, These are some of the example of the past perfect tense we can use over here to distinguish between two events or the order of the events in the past. Now followed by the articles. So articles are basically we have definite, we have indefinite articles. Indefinite articles we have are and an for countable noun if it's singular, and we have to use are with that. If it's plural, we should not use any article before that, before the definite article if it's countable. If uncountable, again, we are not going to use any article with that. Similarly, if it's a countable noun, right? If it's a singular, and if it's give you the vowel sound, A, E, I, O, U, then you can use and before that. For example, despite the fact this MRI start from the word M, that is not a vowel, let's say, but it gives you sound of vowel M. This is the sound of M. Let's say this is the sound of M, if it's not clear. So that's why if it's giving the sound of M, we can use N before that, right? So let's say we can see that whenever we have anything says we'll give you the sound of vowel, such as it's your X-ray. It's not spelled like that. I have written the sound over here. So we use N with that. Anyhow, so we have to use N if it's a singular and give you the vowel sound. We have to use N with that, right? Is it clear to you? We have the, let's say, like definite article. For the example of definite articles, for the example of definite articles, we have to use the with that. So in term of definite article, when we have to specify, when we have to specify, something. So we can see, we can see there that we have to use article da before that, such as she has been suffering from diabetes from the last 4 days, let's say, for the last 4 days, for the last few years, for example, when we have to specify something, or we have to see, let's say she has been having pain in the right shoulder. Okay. She has been having pain in the right shoulder, for example. We can also see there. It should be like that, not years, days. Okay. So basically, you have to see there, she has been suffering from diabetes from the last 2 years. Then Mr. XYZ has been has been on the following medication. He reported pain in the left knee, and in view of the above, let's say, when we have to specify something, we have to use article da with that. We should not use you can say article with the name of the disease. Let's say we cannot say she has been suffering from the diabetes. We should not use article da with that. Then rule of capitalization, like where to use the capital letter. Well, for example, for this capital letter use, we have to see, like if we have a disease, or if it's name against scientists, for example, such as Parkinson, Bell's palsy, let's say, these are those diseases we can use with the capital letter, the first name. But if we have a disease such as diabetes, such as hypertension, no, these are those diseases that we cannot write it down with the capital letter, right? So you can see there, we have to, you can say, you have to use the lowercase letter with that, okay? So is it clear to you? Okay. Afterward, we can move on, afterward, we can move on toward the name of the medication. Now, in the name of the medication, we should not use the capital letter with the first letter of the medication if it's the salt name. But if it's a trade name, we have to use the first letter, right? We have to use the first letter, right? Okay. So basically, for the capitalization, first of all, if we have the name of disease, if it's a proper noun, we can use the first letter capital, such as Alzheimer, Bell palsy, and so on. But if we have a common disease such as diabetes mellitus, let's say hypertension, we should use the lowercase letter, followed by the, you can say medicine name. In case of medicine, what we can see there, if we have a brand name, we use the capital letter first. If we have a trade name, we can use the, sorry, salt name, we can use the small letter first, right? Lowercase. Any medical procedure should be written in the lowercase. These are some example. Body part should be written in the lowercase. With example, okay? Is it clear to you? So afterward, we can see that we have the, let's see the days of month. Okay. With respect to days, let's say Monday, Tuesday, Wednesday, we have to use, you can say, the capital letter with that. Titles, job titles, designation, positions, we have to use the capital letter with that, right? So is it clear to you right now? With reference to, let's say, you can say clauses, the active and passive voice first. So we have to use the active voice and or passive voice depending upon the situation. If we have a situation, let's say that allows you to write in active voice, for example, if it's written, let's say, medicine advice, RV 3/7. Now here, it's important for you to focus on the doctor advice. So we may write it down in the active voice. But if it's written, for example, painkiller, no relief. So we are trying to subject the importance or the non-effective nature of the painkiller. If it's written, let's say painkiller, non-compliant. So we are targeting to focus on the, we are trying to focus on the, we can say the patient behavior. So according to the importance of the case, we have to write it down, the things, right? Anyhow, so I believe it's clear to all of you. These are some example of passive voice, that how and which things to be done, like how to translate the passive voice in different form of the tense. Anyhow, then we have the clauses. In clauses, it's your complex sentences. In complex sentences, we have, let's say, the clause of contrast, clause of purpose, clause of reason, and clause of time, right? Clause of reason and clause of time. Okay. So basically, we have to see, that if we have something to contrast, let's say where you have to contrast, for example, without using but, you need to see that how can you contrast. For example, although he has been taking this medicine on time, he has not been able to, we can say, improve his pain. Let's say, although he has been taking this medicine on time, his condition is not improving, right? Or although, let's say, he took this medicine on time, his condition did not improve, right? Okay. And similarly, despite he was managed conservatively, his pain did not relieve, right? Okay. So when we have to make a contrast between two things, let's say, we can use the different clauses with despite, even though, although, however, and so on. When we write, we have to write it down something for purpose. That action has been done for some reason. We can use in order to, or so that, such as, in order to lose his weight, he was advised to, let's say, join gym. Or we can use again the clause of contrast with that. Despite he joined gym, he was unable to lose his weight. This is, and two example of different clauses can be used together. Similarly, clause of reason can be replaced with clause of purpose, vice versa. Let's say, due to the fact that he was overweight, he was advised to join gym. Previously, we have written this clause in this way. In order to lose his weight, he was advised to join gym. So it can be changed with, due to the fact that he was overweight, he was advised to join gym, right? Similarly, we have a time clause such as while, where, since, on the next visit, at the time of admission. So there are some rules of clauses. The first one is your, we can say, dependent and independent clause. When we use the dependent clause first and independent afterward, we have to use comma in between, such as, although he has been attending physio session on regular basis, his pain is not improving. So the first sentence, although he has been attending physio session on regular basis, this is your dependent clause. And his pain is not improving, it is your independent clause, right? So when we have to use dependent clause first and independent afterward, we should use the comma in between. This is the rule for all of the things, right? Similarly, for time clauses at the time of admission, he was administered, let's say, blah, blah medicine, right? And last, we have the compound sentences and coordinating conjunction. So we can compound the sentence with the help of and, but, so, nor, and yet, and so on. However, we need to learn the understanding of parallel structure. In parallel structure, we can see that we need to make sure that you can use the same form of the verb, maybe active or passive, noun or noun phrase, gerunds, preposition, or so on. For the sake of example, these are two examples that has been done in front of you. He's now worried about his condition. Is your active voice present simple form because he's overweight, lacks exercise, and smokes regularly. So we are using with active verb. Now we can use with the passive verb. During hospitalization, IV fluids were commenced and a transdermal patch was used for her pain. So you can see specifies, we have used same form. We can see that there are some errors we are writing. We can change the form of, maybe we can use the active in first, you can say form over here, and passive voice over here when we are making a compound sentence. And with a noun phrase, like he's now worried about his condition because of his increased weight, lack of exercise, and his habit of smoking. He will require information about how and when to make his medication, how to stop smoking. So you can see that we are using the same noun or noun phrase, right? So these are a few examples to make you clear about the concept of parallel sentence structure or balanced sentence. And similarly, we can understand more from the preposition. Let's say he was advised to lose his weight, join gym, and to take his medicine on time. So to, if you skip the to at the end part of the clause, we are not having a balance or parallel structure. So complex sentences and conditional sentences are also important. We can see that complex sentences, when we combine the two clauses, dependent and independent together, that will become the complex sentence. And conditional sentences can be used at the end of the lecture. Such as, if you have any further queries, please do not hesitate to contact me, right? So these are some general rules of the grammar. Now, somebody has asked me the question that I have repeat with reference to the time frame. So let's have a quick review with that. Let's say in the introduction, we can use the simple present or past perfect tense, or maybe past perfect continuous tense as well. Sorry, present perfect continuous. These are few examples. Thank you for seeing Mr. X, whose sign and symptom are suggestive of diabetes. Or thank you for seeing Mr. X, who has been responding well to the treatment of, let's say, blah and blah, or who presented today with severe chest pain. So these are few examples that I've written over here to use present simple, present perfect, or present perfect continuous. Similarly, for a discharge, we can use past simple, present perfect, and so on. Then tenses in the social history prefer to use the present simple without time frame and present perfect continuous if we have a time frame. And at time, very rarely we can use past history, past perfect tense for past history with the in the history part. Then, if we have the first few visits, the treatment record, right? In the treatment record, we can use with the past simple, right? The treatment record can be used with the past simple tense. Then we can also use the we can say like past perfect tense. As we mentioned that we have to use the when we have to use we have to use in comparison, right? When we have to use in comparison, we can use in this format, right? Anyhow, so followed by the discharge or letter or referral letter. In today's referral, we can use the past simple or maybe present perfect tense, and discharge letter mostly we can use the future tense with the modal verb, right? Anyhow, then we discuss about the present perfect tense. There are some rules for use to since, for, and ever. We also have discussed the rules of past perfect tense and then the articles, right? So I hope it's clear to you till now.